Have you ever picked up the nail clippers, walked toward your dog, and watched them completely transform in front of your eyes? 1 second they were lying there completely relaxed. Tail wagging. Eyes soft. The perfect, trusting version of your best friend. And the moment those clippers appeared, something shifted. They saw them. Their eyes went wide. They scrambled to their feet. They backed into the corner. They looked at you with an expression that broke something small inside your chest. Not aggression. Not anger. Just pure, unmistakable fear. And you stood there holding those clippers feeling like the worst person in the world. Maybe you tried anyway. You got down on the floor. You talked in your softest voice. You offered treats. And for a few seconds they tolerated it. Until the clippers touched their paw. And then the pulling started. The leg yanking. The squirming. The low, desperate whine that they have never made at any other moment in their life except this one. And then it happened. The sound you never forget as a dog owner. That dull, sickening sound when the blade goes too deep. A yelp that fills the entire room. Blood on your hands? Your dog pulling away from you and pressing themselves into the farthest corner of the room. And you sitting on the floor, clippers on the ground beside you, heart pounding, hands shaking, watching a thin line of red run down the nail you just cut too short. You hit the quick. And your dog looked at you in that moment like they did not understand why you hurt them. You told yourself you would never do it again. That you would just pay the groomer. That you would avoid the whole situation entirely. But the nails kept growing. And growing. And now you can hear them clicking on the hardwood floor from the other room. You can see them beginning to curve. And somewhere in the back of your mind you know that overgrown nails are not just a cosmetic problem. They are becoming a health problem. And the longer you wait, the worse both problems get. You do not need to go back to that moment on the floor. You do not need the clippers. You do not need the yelp. You do not need the guilt. What you need is something completely different. And it takes exactly 5 minutes. Hello everyone. I am Dr. Laura Bennett, and welcome back to Paw Secrets Lab. I have spent over 13 years in veterinary practice with a specific focus on canine orthopedics and rehabilitation. And I want to tell you something that most dog owners have never been told by anyone. Overgrown dog nails are not a grooming problem. They are a skeletal problem. A postural problem. A pain problem. And they deserve to be treated with that level of seriousness. But here is what I also want you to know. The solution does not require restraining your terrified dog on the bathroom floor. It does not require expensive grooming appointments every 3 weeks for the rest of your dog's life. And it absolutely does not require you to ever pick up a pair of nail clippers again if you do not want to. What if I told you that there is a 5-minute daily paw routine, used by veterinary rehabilitation specialists and professional animal behaviorists, that gradually and painlessly brings overgrown nails to a healthy length while simultaneously transforming your dog's emotional response to paw handling from terror to genuine comfort? And what if this routine required nothing more than a nail file, a piece of sandpaper, and your own 2 hands? Today at Paw Secrets Lab, we are going to cover everything you need to completely change how you manage your dog's nails. Here is exactly what we are doing together. In Chapter 1, I am going to explain the overgrown nail crisis. You are going to understand exactly what happens to your dog's body, their skeleton, their posture, and their joints when nails grow too long. This chapter alone will change how urgently you think about this. In Chapter 2, I am going to reveal why clippers fail. This is the specific biological and psychological reason that standard nail clipping traumatizes so many dogs and why switching tools, not just techniques, is the real solution. In Chapter 3, I am going to teach you the 5-minute paw routine in complete detail. Every step. Every movement. Every tool. And the precise desensitization sequence that makes the whole thing work. And in Chapter 4 I will walk you through the warning signs that tell you when your dog's nail situation has already caused damage that requires veterinary assessment beyond a home routine. Subscribe to Paw Secrets Lab right now and join our wonderful, growing family of educated, devoted dog parents. Get something to write with because what you learn today is going to change your dog's daily comfort and your weekly stress levels permanently. Let us begin. Welcome to Chapter 1. The Overgrown Nail Crisis. I need you to understand something that is almost never communicated to dog owners clearly enough. When your dog's nails are too long, the problem is not that they look untidy. The problem is not the clicking sound on your floors. The problem is what is happening inside your dog's body with every single step they take. Here is the anatomy that makes this so serious. A dog's paw is designed to contact the ground in a very specific way. The pads make contact first. The nails, in a healthy dog with properly maintained nails, should just barely graze the ground or not contact it at all during normal standing. They are designed to be like the tip of your fingernail. Present, functional for traction on certain surfaces, but not load-bearing. Not weight-supporting. Not part of the primary contact structure. But when nails grow beyond their healthy length, something biomechanically catastrophic begins to happen with every single step your dog takes. The nails make contact with the ground before the pads do. And when a nail hits the ground first, it does not simply bend out of the way. It cannot. It is too rigid. Instead, it transmits force backward into the toe. The toe is pushed upward and backward by the nail-ground contact. The toe joint is forced into an unnatural angle. And to compensate for that unnatural toe angle, the entire paw begins to flatten. The carpus, which is the equivalent of your dog's wrist, begins to drop. The ankle, the stifle, the hip, everything up the kinetic chain begins to compensate for the misalignment that started at the nail tip. Your dog is essentially walking in the equivalent of high heels that they can never remove. Every step. Every walk. Every time they get up from their bed and cross the room to greet you at the door. Their joints are absorbing force at angles they were never designed to manage. Over months, this creates something that veterinary orthopedic specialists see constantly in clinical practice. We call it nail length-induced postural compensation syndrome. The muscles along the back of the leg, the flexors, become chronically shortened and tight. The muscles along the front, the extensors, become chronically overstretched and weakened. The toe joints develop early arthritic changes from sustained abnormal loading. And the dog begins to shift weight subtly onto their front legs to relieve the discomfort in the back, which then creates chronic tension in the neck, shoulders, and thoracic spine. A dog with severely overgrown nails is a dog in a constant, low-level, invisible state of musculoskeletal discomfort. And that discomfort is entirely correctable. But only if the nails are addressed correctly and consistently. Now here is the second layer of the crisis that nobody talks about. Inside each nail is a living structure called the quick. The quick is a bundle of blood vessels and nerve tissue that runs through the center of the nail. In a nail of healthy length, the quick terminates well before the nail tip, leaving a safe zone of dead nail material that can be trimmed painlessly. But when nails are allowed to grow long, the quick grows with them. It extends toward the tip of the nail. It follows the nail as it lengthens. And this is precisely why severely overgrown nails cannot simply be cut back to healthy length in a single session. Cutting an overgrown nail back to where it should be means cutting directly through living, sensitive, heavily innervated tissue. It means guaranteed pain, guaranteed bleeding, and guaranteed trauma that will make your dog 10 times more nailphobic than they already are. This is the nail crisis in its complete form. Long nails distorting posture. And a quick that has followed the nail into territory that makes standard trimming genuinely dangerous. Welcome to Chapter 2. The real reason clippers traumatize dogs. Understanding why clippers create such profound fear and trauma in so many dogs is essential before we can replace them with something that works. Because the problem with clippers is not just that they can cut the quick. It goes much deeper than that. It is biological. It is neurological. And it is completely predictable once you understand it. Here is what actually happens inside a dog's sensory system when clippers are applied to their nail. Standard nail clippers work by applying sudden, concentrated, compressive force to a very small cross-section of nail tissue. The blade does not slice. It crushes through from both sides simultaneously until the nail fractures and separates. For a nail with a well-reseated quick, this is painless. But here is what most owners do not realize. Even painless clipping creates a pressure wave. A physical shock that travels up through the nail, through the quick, through the toe, and into the bone. Your dog feels that pressure wave every single time the clipper closes. Even when you do not hit the quick. Even when there is no blood and no yelp and everything appears to go perfectly. The vibration, the compression, The sudden physical shock travels through sensitive tissue with every single clip. For a dog with any nerve sensitivity in their paws, for an older dog with early arthritis in their toes, for any dog with a quick position close to where the blade falls, that pressure wave is uncomfortable to genuinely painful. And it happens on every nail. Every session. Every time. Dogs do not separate. Today went fine. From last time it hurt terribly. They associate the entire ritual, the sound of the clippers, the smell of your tension, the restrained position, the sensation of their paw being held in a specific way, with the cumulative pain and shock of every previous session. The phobia is not irrational. It is a perfectly rational conditioned fear response to a genuinely uncomfortable procedure that has hurt them before, and that their nervous system correctly predicts will likely hurt them again. Switching to a different pair of clippers does not solve this. Buying expensive clippers does not solve this. Trying harder and going faster does not solve this. The solution is to remove the compressive crushing mechanism entirely. To replace it with something that the dog's nervous system receives as completely neutral. Something that produces no pressure wave. No sudden force. No vibration through sensitive tissue. Something that works so gradually, and so gently that the quick retreats on its own rather than being cut through. That something is mechanical filing. And when it is combined with a specific behavioral desensitization sequence, it transforms the entire nail management experience from something your dog dreads into something they genuinely tolerate, and in many cases, actively approach with curiosity rather than fear. Welcome to Chapter 3. The 5-Minute Paw Routine. This is the complete system. I am going to walk you through every step, every tool, and every behavioral technique so that you finish this chapter knowing exactly what to do tonight, and exactly what to do every morning for the next 4 weeks. You will need 3 things. A metal nail file, medium grit, the kind you can find in any pharmacy for under $3. A piece of 40 to 60 grit sandpaper cut into a square approximately the size of a sheet of printer paper. And high-value treats, small pieces of real cooked chicken, real cheese, or real beef, the kind of treat your dog would do absolutely anything for. The routine has 2 phases. The desensitization phase and the active filing phase. Desensitization phase. Days 1 through 7. Do not touch a nail on day 1. I am completely serious. Day 1 of this routine is entirely about paw handling and tool introduction, not nail work. And this phase is non-negotiable, because it is the foundation that determines whether the entire routine succeeds or fails. Sit on the floor with your dog in a relaxed environment. No clippers in the room. No tension in your body. Have your high-value treats accessible beside you. Pick up one paw gently. Hold it for 3 seconds. Release it. Give a treat immediately. That is it for that paw. Move to the next paw. Hold for 3 seconds. Release. Treat. Work through all 4 paws. The entire session takes under 2 minutes and ends while your dog is still completely comfortable and enjoying the treats. Do this exact session twice daily for 3 days. You are teaching your dog's nervous system that paw handling equals good things. That the moment their paw is lifted, something wonderful arrives. You are building a new association that will overwrite the old fearful one. This rewiring is not optional. It is the biological foundation of everything that follows. On day 4, introduce the nail file during the paw handling session. Do not file anything. Simply hold the file in the same hand that holds the paw. Let your dog sniff it. Treat immediately. Hold the paw with the file present for 3 seconds. Release. Treat. You are teaching them that the tool itself predicts good things rather than pain. On day 5 and 6, lightly touch the file to the outside of one nail without moving it. Just contact. 1 second. Treat. Contact again. Treat. You are introducing the sensation of the tool on the nail in the most minimal, non-threatening way possible. Most dogs show no response at all during this step, which is exactly what we want. On day 7, make your first filing stroke. 1 slow, forward stroke on one nail of one paw. Treat immediately and enthusiastically. End the session right there. 1 stroke. 1 treat. Done. Active filing phase. Day 8 onward. Minute 1. The warm-up. Spend the first 60 seconds doing gentle paw massage on all 4 paws using the techniques from our morning activation sequence for senior dogs. Circular thumb pressure on the pads, gentle toe separation, light stroking along the top of the paw. This warms the tissue, increases blood flow to the nail bed, and signals to your dog's nervous system that this is a safe, pleasant experience rather than a threat. Minutes 2 and 3. The sandpaper scratch method. Place the sheet of sandpaper flat on the floor in front of your dog. Now, instead of you filing their nails, you are going to teach your dog to file their own front nails. Hold a high-value treat just above the sandpaper at your dog's nose level. When they reach for the treat, their front paws will naturally scratch forward across the sandpaper surface. The moment their nails make contact with the sandpaper, they receive the treat. Repeat this 10 to 15 times. What is happening mechanically is extraordinary. Each forward scratching motion draws the nail tip across an abrasive surface, removing a tiny, controlled amount of nail material with 0 compression force, 0 pressure wave, and 0 quick trauma. Your dog is not experiencing any sensation beyond the mild scratching feeling of their nail on a rough surface. It feels nothing like clippers. Their nervous system receives it as completely neutral. The sandpaper scratch method is specifically effective for front nails because it mirrors the natural scratching behavior dogs already perform instinctively. For many dogs, it becomes genuinely enjoyable because it is paired with treat delivery and because it mimics a movement their body already knows. Minutes 3 and 4. Hand filing the back nails. While your dog stands or sits calmly, use the metal nail file on each back nail with slow, forward direction strokes from the base of the nail toward the tip. Use 3 to 5 strokes per nail. Apply moderate, consistent pressure. The direction is critical. Always file from base to tip, never side to side, because side to side motion creates lateral pressure that the dog feels as uncomfortable vibration in the toe joint. Treat after every 2 nails. Do not attempt to file all nails in one session in the first 2 weeks. If your dog shows any tension, any pulling, any stress signals like lip licking or whale eye, stop immediately. Give a treat. End the session positively. The consistency of the routine matters infinitely more than the amount accomplished in any single session. Minute 5. The reward ritual. Every single session ends the same way. A brief, enthusiastic celebration. Verbal praise in your happiest voice. A final high-value treat. And 30 seconds of whatever your dog loves most, a chest scratch, an ear rub, a brief play moment with their favorite toy. This final minute is not optional sentimentality. It is behavioral science. The brain encodes memory most strongly at the end of an experience. A consistently joyful ending to the paw routine rewires the entire association around nail care from dread to anticipation. Within 4 weeks of this daily 5-minute routine, most overgrown nails will have reduced measurably in length as the filing removes material daily. More importantly, the quick will have begun its natural recession. As small amounts of nail are removed each day, the quick receives the biological signal to retreat back toward the toe. It retracts gradually over weeks, creating the safe zone of dead nail material at the tip that makes further maintenance progressively easier and safer. Welcome to Chapter 4. When overgrown nails need veterinary intervention. The 5-minute paw routine is designed for dogs whose nails are overgrown but structurally intact. There are specific situations where overgrown nails have already caused damage that a home routine cannot address and that require professional assessment immediately. If your dog's nail has curved so severely that it has begun growing into the pad tissue, this is a medical emergency. An ingrown nail piercing the pad creates an open wound that is acutely painful and immediately susceptible to deep tissue infection. Do not attempt to cut or file an ingrown nail at home. Call your veterinarian today. The nail will need to be removed under sedation and the wound treated appropriately to prevent serious infection. If you notice any nail that is cracked, split, or broken with exposed tissue or bleeding at the break point, do not file or clip this nail under any circumstances. A fractured nail with exposed quick is extraordinarily painful and is vulnerable to infection. Wrap the paw loosely with clean gauze to reduce contamination and go to your veterinarian or an emergency clinic for proper nail removal and wound management. If your dog has been walking on severely overgrown nails for an extended period and you notice they are consistently stumbling, crossing their rear legs when they walk, or showing reluctance to bear weight on one or more limbs, the postural compensation damage has potentially progressed to a point requiring orthopedic evaluation. An X-ray of the toe joints may be appropriate to assess whether arthritic changes have already begun. If one specific nail is dramatically different in appearance from the others, discolored, thickened, brittle, or with changes in the surrounding nail fold tissue, these changes can indicate a nail bed infection, a fungal condition, or in rare cases an immune-mediated or neoplastic condition affecting the nail. Any isolated nail abnormality that does not match the appearance of the other nails deserves veterinary examination rather than home management. And if you attempt the 5-minute routine consistently for 4 weeks and see no improvement whatsoever in nail length, or in your dog's comfort level with paw handling, please bring your dog to your veterinarian for a complete paw and nail assessment. Some dogs have underlying anxiety disorders that require professional behavioral support beyond desensitization routines. Your vet can refer you to a certified veterinary behaviorist who can provide a complete management plan. You came here today because you remembered a sound. A yelp. A moment on the bathroom floor with blood on your hands and your dog pressed into the corner looking at you with eyes full of confusion and fear and something that felt like betrayal even though you know they do not think that way. You know it was an accident. You know you were trying to help them. But the memory stayed. And it changed how you feel about nail care forever. That memory is not a source of shame. It is evidence that you care enough to feel it. That you have spent time carrying the weight of a moment your dog has almost certainly already forgotten while you have held it every time those clippers appeared in your hand. You can put the clippers down now. For good, if you want to. A nail file from the pharmacy. A square of sandpaper from the hardware store. 3 seconds of paw holding. A piece of cooked chicken. 5 minutes every morning before you make your coffee. That is the entire system. That is all it takes to bring those nails back to a healthy length, to give your dog's skeleton and joints the relief they have needed, and to replace one of the most anxiety-filled rituals in your household with something that ends with your dog wagging their tail and looking at you for another treat. The clicking on the hardwood floor will stop. The curved nails will straighten. The postural discomfort will ease as the nail length corrects, and the skeletal alignment improves. And somewhere around week 3 of this routine, something extraordinary will happen. You will reach down to pick up your dog's paw and they will not pull away. They will just let you. Maybe they will even lean into it slightly. Because their nervous system has been quietly, consistently learning a new truth. That paw touching means good things now. That the person holding their foot is safe. That this is not something to fear anymore. You gave them that. 5 minutes at a time. Tell me about your dog in the comments below. Is it the clippers they hate, or is it the paw handling itself? Does your dog run the moment they see the clippers, or do they tolerate handling but panic at the tool? Understanding which part of the process is the fear trigger helps me give you even more specific advice for your individual dog. Tell me everything. If this masterclass gave you a genuine alternative to something you have been dreading, if it gave you a clear path forward where there was only anxiety before, please tap the like button. It tells the algorithm that practical, fear-free veterinary education matters, and it carries this video to every other dog owner sitting on their bathroom floor right now wondering if there is a better way. Subscribe to Paw Secrets Lab and join our incredible, compassionate community of educated dog parents who are choosing better methods for their animals every single day. I am Dr. Laura Bennett. Get that nail file tonight. Cut that sandpaper square. Cook a small piece of chicken. And tomorrow morning, pick up one paw, hold it for 3 seconds, give the treat, and begin. Your dog's joints, their posture, their comfort, and their trust are all waiting on the other side of 5 minutes. I will see you in the very next video.